Pain. Pain is the most subjective piece of data that the nurse collects from the patient. Our clients experience pain. As a nurse, I can't see it. I can't feel it. I can't taste it. I can't smell it. So it's whatever the patient tells me it is. When we look at pain, both the central nervous system and the peripheral nervous system process various stimuli throughout our environment. Processing this stimuli mobilizes nociceptors. Nociceptors are sensory receptors for noxious stimuli. When this processing takes place, these nociceptors, the pathway is now activated. When this pathway is activated, the subjective response that the individual experiences, feels, is considered pain. Pain can also be from a somatosensory cortex. So the somatosensory cortex is a sensory system in the brain that receives impulses from body areas. A pain threshold and pain tolerance are both still subjective pieces of information from our patient. Pain threshold is defined as the point where the stimulus causes the individual's perception of pain. Pain tolerance is defined as how much of that stimulus an individual can accept. So where's their pain tolerance? Everybody's pain tolerance varies. Okay, there's no two people that we can identify as the same because I can't see someone else's pain. I can see objective signs maybe written on their face. Maybe they may guard their side. They may grimace. I may see that. But as far as what that person is feeling at that given moment, I can't experience it. So there are various types of pain. When we look at acute versus chronic pain, this is based on duration, length of time. So acute pain, it's sudden or has a slow onset, either or. It can be very intense or it can be minimal intensity. But with acute pain, there is a time frame that is expected to end. Okay, so there's some anticipated time frame there. Routinely acute pain lasts less than 6 months. Okay, so think about pain from having surgery, the incision site, maybe pain from scalding your hand. Now, chronic pain, it can also have a sudden or a slow onset of intensity, but it is constant. It is recurring. There is no anticipated end with it. It is stated as having a duration that lasts longer than 6 months. Okay, so chronic pain and acute pain are different in their length of time for the patient. Now we have nociceptive versus neuropathic. So this is where the pain relates to the point of origin. Okay, so where did the pain start? All right, we have nociceptors in multiple body parts, and these are activated by chemical substances, tissue damage, extreme temperature, pressure changes. All right, so there's types of nociceptive pain. There's somatic, there's visceral, and there's cutaneous. Somatic pain, this starts in skin, bones, joints, muscles, connective tissue. So think of skeletal pain, okay? It's bones and muscles and tissues. Now, visceral pain, this is internal pain, okay? This is due to some internal organ, but the pain is felt in a different area of the body. So in visceral pain, the pain is now referred to other body locations. Like somebody having kidney, they have a stone in their kidney and they're getting flank pain. Cutaneous pain is pain that occurs either in the skin or the subcutaneous tissue. Okay, so that is all nociceptive pain. Neuropathic pain. This is nerve pain. This comes from the somatosensory system. Examples are diabetic neuropathy, phantom limb pain after having an amputation, pain with a spinal cord injury. Okay, so that's neuropathic pain. That is nerve pain. They've also begun to recognize cancer as a type of pain. And the reason that is being recognized and being studied is because we have people that are living longer. And as medical professionals, we are trying to define and treat that unique pain for that individual. One thing I know about pain is pain increases with neuropathic conditions, joint and lower extremity conditions, and as we age. Okay, so if we get a nerve issue with age, we get joint issues, maybe on bad knees, we're going to have pain. Aging process also increases the chance of an individual experiencing a chronic pain condition, something like arthritis. So there are legal considerations when we're thinking about managing pain. There are standards of care for the management of an individual or client's pain. If this management and these standards are not followed and not adhered to, this can lead to a malpractice charge. This would be a negligent act that is performed by a professional nurse. If you remember, we have our own set of standards for the nursing practice. Negligence itself is failing to perform as that reasonable and prudent nurse would perform. So that perfect nurse. We also have various ethical concepts that we consider when we're dealing with an individual and their pain. One is beneficence. So doing good and acting in the best interest of our individual to provide care that benefits the individual. Okay, so if you think about by controlling and alleviating the individual's pain, it helps decrease and minimize the amount of suffering that they go through. Non-maleficence is where we are working to do no harm. As a nurse, if we fail to manage pain, this can cause our client harm, and it is our ethical responsibility to avoid this outcome. Autonomy. This grants the individual the right to self-determination. Autonomy permits individuals the freedom of choice based on informed decisions. As a nurse, it is my responsibility to provide education that the client needs to make an informed decision. Justice. Justice is to treat everyone equally throughout our nursing profession. So when we're discussing pain and we look at a pain assessment, there's a mnemonic, the PQRST mnemonic. So the P, the precipitating cause. A question you might ask, what were you doing when the pain started? For Q, the quality. Describe what your pain feels like. The R, region. Show me the location where you are experiencing pain. The S, severity. On a scale of 1 to 10, how would you rate your pain? Okay, 1 is minimal pain for you, and 10 is the worst pain you can even imagine. The T is timing. So I want to know, when did your pain first begin? And have you experienced this pain before? Now there are various pain scales that can be used. The numeric rating scale, that is your 0 to 10, where the client will actually verbalize to you their pain. When we look at the scores, a 0 is no pain and a 10 is severe pain. So 1 to 3 would be considered mild, and 4 to 6 would be considered moderate. The Wong-Baker FACES pain rating scale. This is used routinely for children ages 3 and under. This is for the actual client to rate their own pain, not for the parent to rate the pain for the child. We also have the FLAC scale, that is face, legs, activity, cry, consolability. This is an observational pain assessment tool. This is used with children that are age 2 to 7 years, and any individual that is cognitively disabled. So there are various things that a nurse can do to help the client in pain relief. One is positioning. So by using proper positioning for our clientele, this will prevent injury and additional pain. Moving them, positioning them off of a bony prominence to help avoid pressure injuries. Making sure that when they are moved in bed, that we're using a draw sheet so we can avoid any shearing injuries. And ensuring that they change positions minimally every 2 hours. There's also cutaneous stimulation. Individuals will respond to types of cutaneous stimulation: heat and cold therapy, touch, acupressure, acupuncture, massage. If heat and cold are used for therapy, these are to be applied for no more than 20 minutes at a time, and with a 20-minute break in between each use. Cognitive strategies. This is cognitive behavioral therapy. This is where we educate an individual how to manage negative thoughts and their maladaptive behaviors. The nurse will assist the client to adapt new behaviors to help decrease their anxiety, stress, and chronic pain. These will be interventions like distraction, relaxation techniques, imagery, music therapy. There is also therapeutic touch. This is where a nurse will actually use their hands on or near the body. This is stated to balance the energy and help promote healing. If you think about the elderly population, these are benefits that you may witness in these individuals. An improved mood. A better or a greater sense of well-being, decreased pain level, decrease in their nausea, decrease in their anxiety. Opioids are a medication that are routinely prescribed to help with pain relief. These actually act to help suppress the pain sensors because it activates the opioid receptors in the brain, the spinal cord, and the central nervous system. These various medications cause sedation and depression of the respiratory system. So the nurse, when giving opioids, needs to make sure that they perform their client assessment and watch for any adverse reactions. There are three classes of opioids. There are natural opioids. These come directly from the opium poppy. Codeine and morphine are examples. Semi-synthetics. These are created from the natural occurring opiates. Heroin, hydrocodone, oxycodone, hydromorphone. There's also synthetic opioids. These are manufactured. Examples are fentanyl, fentanyl analogs, tramadol. Patients can also use a PCA pump to help manage their own pain. This is a patient-controlled anesthesia. This permits the individual to get small amounts of a medication at a continuous rate or at a basal rate, what the body routinely would use, as prescribed by a healthcare provider, or the patient can also get a bolus of medication when they push the button. However, there are limits to the amount of medication and the timing of the medication. Non-opioids. These are administered for the treatment of pain. These are local anesthetics, non-steroidal anti-inflammatory drugs or NSAIDs, acetaminophen. So NSAIDs are effective for chronic and acute pain, and these are some of the most prescribed treatments for clients. There are also what is called adjuvant analgesics. These assist with pain relief. They help to address the underlying pain generators. These are used for mild pain with opioids to help decrease the amount of opioid that is necessary for the pain. And they also assist to manage neuropathic pain. Adjuvant medications are not labeled as a separate class of medications. These are corticosteroids that reduce inflammation, antidepressants, botulinum toxin,